One of the biggest misunderstandings about Pueraria mirifica is that it is just another menopause herb. It is not. This plant contains unusually strong phytoestrogens, which are plant compounds that can act a little like estrogen in the body. That does not make it a natural hormone replacement. It makes it something you should understand before you swallow it. In this video, you will learn what Pueraria mirifica actually is, how it may work, who might consider it, who should avoid it, what the research really says, and the safety red flags that matter most. And here is one change you can make today. Before buying any hormone-like supplement, write down every medication, birth control, hormone product, and supplement you already use. Then review that list with a qualified clinician or pharmacist. Do not start, stop, or change supplements or medications without professional guidance, especially when hormones are involved. Pueraria mirifica is a climbing plant, native to parts of Thailand and nearby regions. You may also hear it called white kwao krua. The useful part is usually the root, which is dried and turned into capsules, powders, creams, or vaginal gels. A simple way to picture it is this. Your estrogen receptors are like locks on the surface of certain cells. Estrogen is one key your body makes. Pueraria mirifica contains plant-made keys that may fit some of those locks, but not always in the same way, not always with the same strength, and not always with predictable results.
The main compounds people talk about are miroestrol, deoxymiroestrol, and several isoflavones. Isoflavones are plant compounds also found in soy, though Pueraria mirifica is not the same as soy. These compounds are called phytoestrogens because phyto means plant, and estrogen refers to hormone-like activity. So how could it work in your body? First, it may bind to estrogen receptors. These receptors are found in places like breast tissue, bone, the brain, blood vessels, the uterus, and vaginal tissue. That is why people connect Pueraria mirifica with menopause symptoms, vaginal dryness, skin changes, and bone metabolism. But receptor binding is not the same as guaranteed benefit. Second, it may influence tissue moisture and cell turnover in areas that are sensitive to estrogen, especially vaginal tissue after menopause. When estrogen drops, vaginal tissue can become thinner, drier, and more easily irritated. A topical product may act more locally than a capsule, although absorption and effects can still vary. Third, it may affect cholesterol and bone turnover markers. That means it may influence signals related to how your body handles fats in the blood and how quickly bone is being broken down and rebuilt. But markers are not the same as long-term outcomes. Improving a lab marker does not automatically mean fewer fractures or fewer heart problems.
Your body does not make Pueraria mirifica. It is not a vitamin, mineral, amino acid, or essential nutrient, so you cannot be deficient in Pueraria mirifica. What your body does make naturally is estrogen, mainly from the ovaries before menopause and in smaller amounts from other tissues after menopause. Estrogen levels are affected by age, menstrual status, pregnancy, body fat, certain medications, medical conditions, surgery that removes the ovaries, and cancer treatments. This is important because many people search for Pueraria mirifica when what they are really noticing is a change in estrogen signaling. That can show up as hot flashes, night sweats, vaginal dryness, pain with sex, sleep disruption, mood shifts, skin dryness, or changes in cholesterol and bone density after menopause. But those symptoms can also come from thyroid problems, iron deficiency, medication side effects, stress, infection, diabetes, autoimmune disease, or other hormone changes.
Now, let's talk about sources. There are no normal grocery store foods that give you a reliable dose of Pueraria mirifica. You usually get it only through supplements or topical products. But if your goal is general hormone-supportive nutrition, food still matters. You can build a base with soy foods, like 100 to 150 grams of tofu, 250 milliliters of soy milk, or about 80 to 100 grams of edamame a few times per week. You can add 10 to 20 grams, about 1 to 2 tablespoons, of ground flaxseed daily. You can also support bone and metabolic health with enough protein, calcium, vitamin D, magnesium, strength training, and regular sleep. Food may be enough if your symptoms are mild, your main goal is general health, and you do not have a specific menopause-related concern that needs medical treatment. Supplements may make more sense to discuss if you are postmenopausal, you have bothersome symptoms, you cannot use certain standard options, or you are considering a targeted vaginal product for dryness. But natural should not mean unsupervised.
Pueraria Mirifica supplements usually come as capsules, tablets, powders, creams, or vaginal gels. Oral doses in products often range from about 50 to 100 milligrams daily, and some studies and products use higher ranges. Because products are not standardized in the same way prescription medications are, 2 bottles can say the same dose and still deliver different amounts of active compounds. Timing is usually simple. Many people take oral capsules with food to reduce stomach upset. Taking it with a meal that contains some fat may help absorption of certain plant compounds, though exact absorption data are limited. Avoid stacking it with multiple estrogen-like herbs at the same time, such as red clover, high-dose soy isoflavones, or strong menopause blends, unless your clinician says it is appropriate. Quality matters a lot here. Look for the full botanical name, Pueraria Mirifica, not just Quayo crua. Look for third-party testing when available. Avoid products that make extreme claims like rapid breast enlargement, hormone replacement, fertility enhancement, or guaranteed menopause reversal. A realistic monthly cost may range from roughly $10 to $35, depending on brand, dose, and testing. A higher price does not automatically mean better quality.
What can block or complicate absorption? Digestive issues, inconsistent use, poor product quality, taking too many competing supplements, and medications that affect digestion may all change results. But the bigger issue is not just absorption. It is whether the product is appropriate for your body in the first place. So who might need to pay attention to this topic? Not because you need Pueraria Mirifica, but because you may need a conversation about menopause, hormones, or vaginal health. If you have hot flashes that disrupt your day, night sweats that wake you up, vaginal dryness, pain with sex, frequent urinary discomfort, low libido with dryness, or new sleep changes around midlife, it is worth discussing options. If you have early menopause, surgical menopause, or cancer treatment that affected your ovaries, you especially deserve personalized guidance. A simple self-check is this. For 2 weeks, track your top 3 symptoms, how often they happen, how severe they feel from 1 to 10, and what seems to trigger them. Also track your cycle pattern if you still have periods. Bring that to your clinician. It is much more useful than saying, I just feel off.
Labs and tests to discuss may include a pregnancy test, if relevant, thyroid-stimulating hormone, a lipid panel, liver enzymes, kidney function, fasting glucose or A1C, vitamin D, and a bone density scan if you are at risk for bone loss. Hormone labs like FSH or estradiol can be helpful in some situations, but they are not always needed to diagnose normal menopause. If you have abnormal bleeding, pelvic pain, breast changes, or a history of hormone-sensitive cancer, you need medical evaluation before any estrogen-like supplement. Now, let's make this practical with a few real-life examples. If you are the budget eater, do not start by spending money on a trendy hormone supplement. Start with the basics: soy or beans for protein, ground flaxseed, strength training twice a week, daily walking, and enough calcium from food. If symptoms are still bothering you, then talk with a clinician about options. If you are vegan, you may already eat more phytoestrogens from soy, flax, legumes, and whole grains. That does not mean Pueraria Mirifica is automatically safe or unnecessary. It means you should avoid piling multiple hormone-like supplements on top of each other without a plan. Also check vitamin B12, vitamin D, iodine, iron, and omega-3 intake, because low levels can mimic fatigue and mood symptoms.
If you have a health condition like breast cancer history, endometriosis, fibroids, blood clots, liver disease, migraines with aura, lupus, unexplained vaginal bleeding, or you use hormone therapy or birth control, do not experiment with Pueraria Mirifica on your own. Your situation needs professional guidance because estrogen-like activity can matter. The evidence reality check is this. The research is promising in some areas, mixed in others, and still early overall. For vaginal symptoms after menopause, the evidence is probably the most directly relevant, especially with topical gel studies lasting around 12 weeks in postmenopausal women. For hot flashes, sleep, mood, cholesterol, and bone markers, the evidence is smaller and less settled. Some studies suggest improvements, but they are not large enough or long enough to prove major long-term outcomes. There have been small human trials, including studies in postmenopausal women using oral Pueraria Mirifica for a few months, and studies comparing vaginal gel with placebo gel over about 12 weeks. Some measured symptoms, vaginal pH, vaginal health, cholesterol, or bone turnover markers. That is useful, but it is not the same as having thousands of people followed for years.
What we still do not know is important. We do not know the ideal dose for most people. We do not know the long-term safety of daily use for years. We do not know how safe it is for people with hormone-sensitive conditions. We do not know whether it reduces fractures, heart attacks, dementia risk, or other major outcomes. And we do not know whether every supplement on the shelf contains consistent active compounds. Now, safety. The more likely side effects are mild stomach upset, headache, breast tenderness, bloating, nausea, changes in bleeding pattern, or skin reactions from topical products. Less common but more concerning issues include unusual vaginal bleeding, breast lumps or nipple discharge, worsening migraines, allergic reactions, liver-related symptoms, or signs of a blood clot. Medication interactions that matter include hormone therapy, birth control pills, estrogen blockers, aromatase inhibitors, tamoxifen, fertility medications, and possibly blood thinners. There may also be concerns if you take medications affected by liver metabolism or if you are on treatment for diabetes, cholesterol, or thyroid disease. The interaction data are not complete, so the safe move is to ask your clinician or pharmacist.
Pregnant and breastfeeding people should avoid Pueraria Mirifica unless a qualified clinician specifically recommends it, which is uncommon. Teenagers should avoid it unless supervised medically. Older adults should be cautious because they are more likely to take multiple medications and have clot, cancer, liver, or cardiovascular risk factors. Anyone with estrogen-sensitive cancer, unexplained bleeding, liver disease, a history of blood clots, or high-risk gynecologic conditions should not self-prescribe it. Stop and seek medical help if you notice chest pain, shortness of breath, one-sided leg swelling, sudden severe headache, vision changes, fainting, yellowing of the skin or eyes, dark urine, severe abdominal pain, a new breast lump, nipple discharge, or vaginal bleeding after menopause. Those are not detox symptoms. Those are red flags. Now, a quick myth-busting round. Myth 1. Pueraria Mirifica is natural, so it is gentle. Not always. Natural compounds can still have hormone-like effects. Myth 2. If a little helps, more works better. Wrong. With phytoestrogens, higher doses may increase side effects without giving better results. Myth 3. It is basically the same as soy. No, soy foods and Pueraria Mirifica supplements are not interchangeable, and the strength and compound profile can be very different.
Here is the big takeaway. Pueraria Mirifica is a Thai root with plant compounds that may act on estrogen receptors. It may have the most practical evidence for certain menopause-related vaginal symptoms, while evidence for hot flashes, cholesterol, skin, breasts, and bone health is still limited or mixed. Your body does not need Pueraria Mirifica, and you cannot be deficient in it. If you are considering it, treat it like a hormone-active supplement, not like a casual multivitamin. Your one action today is simple. Make a 2-week symptom tracker and list every medication, hormone product, and supplement you take. Then bring that list to a qualified clinician or pharmacist before starting Pueraria Mirifica. Have you tried Pueraria Mirifica? Soy isoflavones, red clover, or another menopause supplement? What did you notice, good or bad? Share your experience in the comments and let us know what supplement you would like to learn about next.